Thank you for joining us tonight. I'm Monique Minglavin from the Cairo 7 studios.
Hi, Monique. Hi again, everyone. I'm Steve Rabel, social distancing and reporting from home, as we have been for the last several weeks. Let's get you the very latest numbers now from the state of Washington. There are more than 9,600 cases of coronavirus now reported and 446 deaths. Snohomish is the only county reporting recoveries, and they do have good news to tell. Of its more than 1,700 cases, 998 people have recovered. That is more than 100 recoveries since just yesterday.
And blood tests are in the works that could determine if you have had COVID-19 but didn't show any symptoms. Those tests could be key in developing a vaccine and just maybe help get more people back to work. Cairo 7's Graham Johnson talked with experts about these possibilities.
Not everyone with coronavirus shows symptoms, and there aren't enough tests, so it's hard to know who had COVID and recovered and who might now be immune. Streets are empty as people stay home. But is there a way to figure out who might be able to return if they're immune to coronavirus? Dr. Keith Jerome, head of virology at UW Medicine, tells me a blood test has big possibilities.
We're not looking here for the virus itself, but looking for the body's response to the virus. And that lasts for weeks and months after you've been infected. So we may start to be able to identify people who maybe wondered if they had the infection, or find out, hey, they had it and really hardly even knew. Yeah, I felt a little off a couple days, but I didn't have COVID, no way. And then you find out, well, maybe you did.
Tests for coronavirus antibodies are beginning around the country and could potentially identify people who are protected from the virus because they've already had it.
If so, those people could actually start to be the ones to maybe help rebuild our economy and rebuild our active society.
Dr. Larry Corey is president and director emeritus at Fred Hutch. He tells me scientists are encouraged by data from Asia, where the pandemic began. The rate of people being reinfected is low, suggesting at least some temporary protection.
Do I feel that these assays that say you had past infection are very likely to say that you are going to be protected? The answer is yeah. And I would use this at the moment to say that you probably are immune. But you saw me use the word probably.
There are also questions about how to ramp up widespread blood tests.
Simply drawing blood on 100,000 people is not a small task. Yeah.
Dr. Jerome tells me big diagnostic companies are working on this, and we should start seeing more blood testing soon.
I think it's going to take weeks and months to get everyone tested.
How blood tests might be used to reopen society is not clear, but Dr. Corey tells me the testing will be key for scientists developing a coronavirus vaccine.
We need to solve this problem with a vaccine.
A vaccine, Dr. Corey tells me, is the ultimate solution to eventually moving on from COVID-19. Graham Johnson, Cairo 7 News.